Okay, so where you start is why. Start with the why. Why do you have high blood pressure? So if you have high blood pressure because of stress, and it's a stress hormone problem, then the blood pressure is not your problem. It's the stress that's the problem, because those stress hormones, remember, that's what prevents you from repairing your arteries. Because if you have low stress, you're going to repair your arteries. Yeah, you'll do damage, but you'll repair them. So the pressure is just an indicator that something's wrong. And so what you need to know is why. Why is your blood pressure high?
Hello, everyone. Welcome to the Healthy Heart webinar. We are so glad that you guys are here. It is a beautiful day and I'm excited. I was in a meeting this morning and we were talking about heart health and plaque and all of the different risk factors for heart disease. And that's what we're going to talk about today. In fact, we're going to talk about the top 10 risk. Is that what we decided? The risk factors for heart disease? Is that what the study said? Dr.
Yes.
Saunders has been digging into this. And so he's going to share a bunch of this with us. And he's made a great list, top 10 risk factors for heart disease. And
May not be what you think.
Yes. We'll let him talk more about that. But before he does, I want to just do a quick disclaimer here and just remind you that Dr. Saunders is not your doctor. And so everybody's different. Please consult with your professional before you implement any of the things that are said here. I think that's good enough, right? All right. So again, I am Leslie. If you guys are new here, this is one of our newest webinars. And this came from a lot of requests from many of you. You wanted to learn more about specifically the heart, how to keep it healthy. What should I eat? Are there certain exercises I should do? How do I know if I'm at risk? What tests should I do? These are the types of questions that have been coming in. And those of you who've been on, you know, Cheryl, she heads up all of our customer support team. And so she gets to see a lot of these questions come through. And from all of your requests, we formed this webinar and we thought, you know what, let's let Dr. Saunders do what he does best, teach us in ways that we can understand and give us advice about how to take care of our bodies and how to prevent these things. And then we open it up for questions for you guys. So if you want clarification on something or, you know, you have questions about the stuff that he's teaching, we want to be able to answer as many of those questions as possible. So for those of you on Zoom, feel free to type those in the Q&A. That's just the best place for us to manage those questions. YouTube, Facebook, feel free to type in the comments. And I want to remind you that these webinars are recorded. So you can go to bartonwebinar.com. There is a link to our YouTube channel where you will find all of these webinars. We also have a type 2 diabetes webinar that we have 190 episodes of. You'll find that on our YouTube channel as well. So if you would like to get an education today on your health, on your body, that's a great place to go. So I think with that, let's go ahead and get this party started. I'm just going to read this here. Dr. Saunders sent this to Cheryl and I, and it says, actually, I'm going to open the whole document because I don't want to say anything incorrectly, but it says according to the United Kingdom Artificial Intelligence study on cardiovascular risks from over 400,000 people over the course of 10 years, the neural network choice for the top 10 greatest factors associated with dying from heart disease are, and we'll do this from highest to lowest. Number one, and I'll go ahead and read it, and then we're going to ask Dr. Saunders what it is, see if we have it, or if we should know more about it. Atrial fibrillation is number one. What is that?
Isn't that interesting? Yeah. So atrial fibrillation means your heart is beating irregularly. So the irregular heartbeat is not even in a regular pattern. So some people have a irregular pattern, like they're doing boom, 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 boom. They have an irregular pattern, but it comes in a regular time. Whereas atrial fibrillation It's irregular, like irregular and irregular. There's no regularity to the irregular pattern. So it's like boom, 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 boom. So like there's no pattern to it. Why does that happen? Well, it happens because the atria is where the impulse starts to go down the heart, and then to bring the rest of the heart together so it all beats together. The heart all has to beat together, and it starts in the atrium. But the atrium is not beating regularly, it's beating irregularly. So the atrium is going like this. And so every once in a while, an impulse will come from the atrium and cause the ventricle to beat. And so sometimes it'll be like fast, and sometimes it'll be slow, and sometimes but it's irregular anyway, because the atrium is just like irregularly beating constantly. Well, then your next question is, why does that happen? Of course, it happens because there isn't enough energy in the heart. And so the problem is a lack of energy. What happens to muscle cells and the Purkinje fibers, the fibers that conduct electricity in the heart, the electrical impulses to cause the heart to all beat together, those fibers are also modified muscle cells. And the way they work is kind of interesting. You have to look at it like the old type of mouse traps. Now, when you have a mouse trap, it's trapped, right? It's already before it's already sprung.
Oh.
Okay, it's sprung, and you have to put energy into it and then set it, and then now you have to be really careful because it's ready to go. And so all you need is just a little touch and bam, it goes, right? That's the way muscle cells work. All muscle cells, but the heart being a muscle, that's the way it works. So then you need more energy to reset it, and then all you need is a little tap, and bam, it goes. When that electrical impulse comes through there, it's just making them go like that. And what happens if you're resetting it and it comes in and goes bam? Well, nothing happens. It just keeps resetting, and then it resets, and then it can go, but then it goes after everything else is gone. So it's going to go at different times because it took longer to reset that. Why did it take longer? Because there's not enough energy in there. A normal cell, if you take a muscle cell, in a heart, it has 40% of that heart muscle cell is filled with mitochondria. The mitochondria are constantly making energy for this cell to be able to go boom, 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 boom. Once a minute, once a second, 60 times a minute is kind of a low average. So that's like every second it's got to go, every second. And so that's why it needs that constant supply of energy, a lot of energy. Whereas your muscles in your arms and legs, for example, they don't have that much. They don't have that many mitochondria to make that much energy. So if you ever tried to just hold your arm out for a while, my brother, when he was in the Army, the discipline was that he had to hold, I think it was a book or something. They had to hold it out for like 3 minutes. 3 minutes, that's easy, right? Well, try it for 3 minutes. What happens? Oh my gosh, 1 minute. Oh my gosh, this is getting really happy. 2 minutes. Oh, I can't do it anymore. You finally collapse under the weight of that book. No, the muscles have run out of energy. When you do something like light work, these muscle fibers are going, and then the brain is like moving things around. And these muscle fibers, but they take longer to reset. So they're taking a long time to reset. And by the time 1 minute comes around, you've spent You have no more muscles to contract because it takes more than a minute to reset all of those muscle fibers. In the heart, it's totally different. Every second, you got to reset it. It's got to go. Every single one of those muscle cells has to go every single second. And if you're running or something, your heart rate can get up to 120 pretty easily. What's that? That's every half second. That's 2 times a second. 2 times every second, it's got to go. Well, what happens if there's not enough energy and it takes longer to reset? Well, then you've got this atrial fibrillation. So it's an energy problem. So you already have heart disease when you have atrial fibrillation. So that's why the computer put that as number 1. You're more likely to die from a heart attack if you have atrial fibrillation than any other risk factor on the list. That was number 1. The computer doesn't even care what people think about it. The computer was given 400,000 people's information. They just dumped 400,000, and they put the entire medical record in there. All the diagnoses, all the demographics, everything about that person was just dumped in 400,000 people, and asked the question, okay, which of all of this stuff, test results, everything is associated with dying from a heart attack? And atrial fibrillation came up number 1. And it's because you already have an energy problem with the heart. That's what atrial fibrillation, it's an indicator. It's not the cause. It's just an indicator.
Interesting. Okay.
And how does your heart lose that energy over time?
That's a really good question. Your mitochondria are so important to your body. That's how your energy is made. Is sugar has to go into the mitochondria and be made into ATP, which is the energy. Fat has to go into the mitochondria and be made into energy, ATP, which is energy. So those mitochondria are making energy, and if you don't have enough mitochondria because you've lost them because of toxicity or lack of nutrition, or diabetes would be another one. Chronic stress would be another one. You actually lose mitochondria because stress hormones are catabolic hormones. You're breaking down your body, you're breaking down cells, you're breaking down your connective tissue, and you're losing mitochondria. So there's a lot of different reasons why you could lose mitochondria. And not eating a good diet is a big one. Diabetes is a big one. And toxicity is another one common.
And when someone has AFib, they often go in and they get electrocuted, kind of. They get jump start on their heart. Is that going to solve their problem? Because I know people who do it over and over again and they still have AFib.
Yeah, that's a great question. So you have this problem of the cells are taking longer to reset. So so some of them will reset faster than other ones, and so it's going to be irregular. So what they do then is they shock the heart so that they cause depolarization of all those cells, muscle cells at the same time, and then that causes them to start going together again. And that's a wonderful thing until the ones that don't have enough energy are taking longer to reset again, and then it's going to go back into atrial fibrillation. So unless you fix the underlying problem, just shocking to bring them back together isn't going to fix it permanently.
So interesting. This is very good. Number 2 on the list of the top 10 greatest factors associated with dying from heart disease is ethnicity. And also talking about stress, genetic factors, and lifestyle factors. What do you know about this?
Okay, so remember the computer took demographic information along with all of the tests and everything else, and said, gosh, the ethnicity was a very big risk factor. In fact, it was number 2 of all the risk factors. Well, what is your ethnicity or your genetics have to do with dying of heart disease? Well, it may not be just genetics. Partly, that might have something to do with it. But there's a lot more factors that go into your ethnicity than just genetics. Diet. Your diet's going to be different depending on where you come from and who your ancestors are, right? So, for example, if you go to Arizona, the Pima Indian tribe there, so the ethnically American Indian people have an 80% diabetes rate. And diabetes is associated with heart disease too. So why do they have a diabetes rate so high? Well, some of it has to do with their lifestyle and what they eat and their amount of exercise that they get. Because how do we know that? Because right across the border, the Tarahumara Indians are related and they have the same genetics. And yet in the Tarahumara in Mexico, there's never been a case of diabetes known, type 2. So why is there such a huge discrepancy among people that have the same genetics, the same ethnicity? Well, in Mexico, the Tarahumara Indians, they run from village to village, so they're very active. They grow the food that they eat, so their diet is very different from in America, where they're eating, fry bread and good food, pizza,
Good food.
and drinking sodas, and and so the difference between their lifestyle is a big difference. So you could call it ethnicity as genetics, and that's a part of it. So if you bring other people with different genetics in and have the same lifestyle as the Pima Indians, you're not going to see an 80% diabetes rate. So that part is genetics. But the lifestyle also has a big factor involved in that. So those kinds of things, genetics, lifestyle, and then the amount of stress that you have, if your ethnicity has to do with your socioeconomic status, that's a big part too. And that actually showed up on the list later on specifically. So for all those factors, ethnicity is a big part of heart disease.
Interesting. But I feel like what you're telling us is that we don't have to just settle for it. We don't have to say my family has this, so I'm going to have it too. We can reverse this.
Exactly.
All right.
Well, not only reverse, but prevent it. Keep your heart
Yes.
healthy to begin with. Yeah.
Yes. And we'll talk about that. We'll talk about those steps here shortly. Number 3 on our top 10 greatest factors associated with dying from heart disease, oral corticosteroid inflammation.
Oh, yeah, that's really interesting. So corticosteroid means cortisol. It's cortisone. And people who take prednisone, cortisone, any of those steroid hormones for suppressing inflammation, they're at higher risk for heart disease. So the computer just picks out, okay, there's an association here. But it's not that the cortisone causes the heart disease, although it does contribute by itself. It also is the other half of that is, why are you taking cortisone in the first place? Well, it's because you have inflammation. Well, guess what? Inflammation is associated with heart disease as well. So inflammation, in fact, is in a sense the underlying cause of heart disease. When you have damage to the lining of the blood vessels, the inside lining, due to inflammation, then you start forming clots in there, and then the clots start organizing, which means that they become like a scab, and they stick on there. And so that is due to inflammation. And so people who are given oral corticosteroids, it's because they have inflammation. They already have asthma, they already have allergies, they already have reactions of some kind, arthritis, those kinds of things. the itises. So if they have those kinds of things and they have inflammation, they're more likely to get heart disease because of damage to the lining of the blood vessels. And then add on top of that, remember, this is just number 3. This is a very high risk factor. So when you have high cortisol or cortisone or corticosteroid levels to suppress inflammation, you also suppress the cells that repair the damage to the blood vessels. So you can't repair it. That's part of the problem too. So number 1, they have an illness that causes inflammation, that damages blood vessels. And then number 2, they're given corticosteroids to suppress inflammation, which also suppresses their ability to repair that damage. So boom, double whammy.
Wow.
So I know we would have people probably asking, how much do you have to take? Like if you have a sinus infection and take some steroids to reduce the sinus, or is this really just those who take prolonged use? Not something if you get hit by a car and have to take something because you have inflammation from an accident, but something you take over a long period of time, that's your risk factor? Or is it every single time you take corticosteroids?
That's a great question. Computer didn't answer that question. Oh. But I can help maybe with this, and that is, a short course of steroids probably is going to do all of that damage. With a sinus infection or some throat swollen from a anaphylactic reaction. That's probably not the issue. Although oral corticosteroids generally means you're not getting a shot, so it's not an acute reaction kind of problem as a rule. So I would suspect that was a great question, Cheryl. I would suspect that long-term corticosteroids, somebody with asthma who's being controlled with steroids, or someone with really bad arthritis that's being controlled with steroids, I think that would be probably more likely.
All right, interesting. Okay, number 4, age as a risk factor.
Yeah, see, here's funny though. So that, of course, age. Why is that? Well, as you get older, things that are breaking down are going to break down more. So as you get older, okay, so this is important to know about heart disease. You have the lining of the blood vessel, and there's damage being done to it, and then you make a little clot. And then you can't repair that. So what happens? Well, then you make another little clot. And you can actually do biopsy, and this has been done in studies, do biopsies of the atherosclerosis, the plaques that are in there. They do biopsies, and they can see the layer upon layer upon layer. So as you age, what's going to happen? Well, you're getting more layers and more layers. So as you get more layers, it's so now your blood vessel's this big around because you've added so many layers to that clot because it didn't repair. So age is just essentially going to happen because you're adding layers.
Yeah, you just can't escape it. But you can prevent it, or at least try to prevent it.
Yeah.
All right, number 5, serious mental illness.
Okay, so if you're seriously mental ill, you're going to get heart disease. You laugh. So Cheryl's like cracking up over there because it just doesn't make sense, I'm going to get heart disease. What? It's okay. So why does that happen, and why is that? Why did the computer make that association, serious mental illness with heart disease? Because it's huge. It's really big. And in fact, it's so huge that the people with serious mental illness, and I'm not talking about I'm feeling depressed today, or I have postpartum depression, or even a mild bipolar disorder. We're talking serious mental illness, people who are non-functional because of mental illness, schizophrenia, severe bipolar disorder, severe depression, severe anxiety. I've had to put a lot of people with anxiety on disability because they just can't go to work, can't function. So we're talking like severe mental illness. as opposed to mild or intermittent or occasional mental illness. Like everybody gets depressed, almost everybody. Some people just never do. So the serious mental illness is also related to another thing that we just talked about, and that is the cortisol. The adrenal glands are making extra cortisol whenever there's stress. And guess what serious mental illness is? There's a lot of stress involved. And a lot of stress means having a chronically high elevated cortisol level. And what does that do? That prevents you from repairing the damage to the lining of the arteries. So as you're doing damage to the arteries, and what does that have? Well, everybody gets damage to their arteries. It's a fairly common thing. Everybody else repairs it pretty easily. But people with serious mental illness have so much cortisol, so much stress hormones that they don't repair the damage to their arteries. And it's really serious. Like people with schizophrenia, serious schizophrenia who are non-functional or dysfunctional, have a 20 times higher risk of suicide. And then all of the rest are likely to die from heart disease. It's like 2/3 of the people with schizophrenia are likely to die from heart disease. It's that significant. If you don't repair your arteries, then you're going to get disease. And when you don't repair it, that's what happens. You get what we just talked about. You get a layer upon layer upon layer upon layer until they're completely blocked off.
They suffer in more ways than one. They suffer from their mental condition, and their body suffers from it. You don't think that their body's hurting. You just think it's a mental thing, not a full body attack. But it really sounds like it is.
Yeah. It's
and what
serious.
about the side effect of the drugs that they're using? Does that impact?
Yeah, but that impacts in a different way. Usually that impacts in causing damage to the lining of the blood vessels. So it's called endothelium. We'll probably talk a lot about endothelium, because endothelium is the cells. It's one cell layer around that artery. It's just one cell, and they're right next together, and they form a lining inside. And whenever there's any damage to it, underneath those big blood vessels is some chemicals that cause clotting. And so you clot really quickly. If you cut a blood vessel, you clot really quickly. If you only cut tiny blood vessels, think about this. Have you ever had this, like you cut yourself shaving, or you don't shave on your face, right? Cut yourself shaving, whatever, or a paper cut or something like that. They're not deep cuts; they're really shallow cuts, and they keep bleeding and bleeding and bleeding. Hey, why did it stop bleeding? They put the toilet paper on, just poke it on it, and watch the blood just kind of go into it, and hope it'll stop bleeding soon. Why does it keep bleeding with these little teeny cuts, and then you get a bigger cut and it stops? It's because in the larger blood vessels, as you cut through the artery walls, there's chemicals in there that cause clotting really quickly, so it'll clot off really fast. Whereas the teeny blood vessels, they don't have that. So when you just cut a few teeny blood vessels, like with a razor or a paper cut or something, it bleeds and bleeds and bleeds. Why is that important? Because you never see atherosclerosis in the little teeny blood vessels. They're only in the big blood vessels where you have those chemicals that cause clotting. And you also don't see it in veins. People don't get atherosclerosis in their veins. But guess what happens? If you take a vein out of somebody's leg that doesn't have any atherosclerosis and can never get it, even though their arteries are full of it, they can never get it. And then you patch somebody's heart. So you do what's called a bypass surgery. And they patch it in from the aorta, let's say bypass it into another blood vessel. And now it's got arterial blood flow. It's got the pressure of the artery in there. Guess what happens? atherosclerosis. It starts getting atherosclerosis because it starts acting like an artery instead of like a vein. So kind of interesting, huh?
Wow. That is very interesting. Oh, again, the body is amazing. Okay.
Amazing.
All right. Another risk factor, number 6, low SES.
Low socioeconomic status. So if you don't have enough money, you're going to die of heart disease. And like, think about it. This is number 6. Have we gotten to cholesterol yet? No. Have we gotten to high blood pressure yet? No. So the computer is just saying, okay, these are all the data entered in, and the associations are, and we've had 2 now with socioeconomic status. One was ethnicity, and now is specifically socioeconomic status, which was part of the demographics that were entered in the computer. So why is that important? Well, of course, there's a lot of reasons. It's not if you don't have enough money, your heart starts making a bunch of atherosclerosis, or you get a heart attack because you couldn't pay your bills or something like that. But there's also other associations. So for example, you could have more stress. Remember, stress causes higher cortisol levels that prevents you from repairing the damage. That's just like having mental illness, right? Is a financial illness the same as mental illness? Maybe, but for stress, maybe there's a part of it there. Also, people with lower socioeconomic status tend to be overweight, not take care of themselves, eat more junk food, and not sleep as well. And so there's other stressors involved, including chemical stressors, physical stressors, and then lack of sleep. So all of these factors enter in, and it's not just one thing. Yes, there's financial stress. It may be an issue, but all of the other things that tends to happen too. So socioeconomic status, it's bigger than cholesterol, guys. This is not a small thing. And so looking into that and going, gosh, I have a lot of financial stress. Maybe we should do something about that. I don't know.
I'm going to throw this in here too. LDL cholesterol came in number 46 of 48 on this list.
Yeah.
Essentially, it says essentially not associated at all with heart disease.
Yeah, essentially. So that's the funny thing, computers are not political. Unless they're programmed to do so, but this one wasn't. This was just programmed to say, okay, just give us associations. And so it gave us association. And guess what? There's no association, essentially none, with LDL cholesterol. And yet, if you go to your cardiologist, you're like, oh my gosh, your LDL cholesterol's up. We got to do something. You're going to die any minute now. And it's like, doc, no, there's no association. Didn't you know that?
Go in and try that. Say that to your doctor. See what happens.
I had somebody do that. I had somebody remember that graph I showed, the cholesterol graph?
Yeah.
This one right here. You're more likely to die with low cholesterol than with high cholesterol. And he said, I want a copy of that. So he took it to his cardiologist. Cardiologist like, I don't believe it. That was the end.
Wow.
So the customer service team, we watch some of these videos or listen to them while we work. We're educating ourselves so we can help our customers. And so for this week, we watched one of the last one about where we talked about cholesterol, and a bunch of the agents were like, I did not know. And they were like, Mom, Dad, take a look. You don't have to worry about cholesterol. It was so fun and they loved the graphics because that made a big impact too. But everyone's learning cholesterol is not a big deal for heart disease.
Yeah, so interesting.
Not even related. Yeah, it's weird.
All right, moving along here. Number 7, top 10 greatest factors associated with dying from heart disease. Number 7 is chronic kidney disease.
Okay, CKD, chronic kidney disease. Now, think about this. If you have chronic kidney disease, why does that cause heart disease? It doesn't. But if you have chronic kidney disease, you have vascular disease. That's why you have chronic kidney disease. And so if you have diabetes, for example, you have chronic kidney disease and you have heart disease. So remember, the computer is just putting associations together, not causation. So whatever is causing your kidney disease is also causing your heart disease. That's why that's important.
Wow, very interesting. Okay. Number 8, normal body mass index is protective.
Oh, this is really interesting. Okay, number 8. So remember, it's association with heart disease. And so number 8 came up with body mass index, and that is a height to weight ratio. So if your height to weight ratio is normal, then this number 8 was the 8th on the list that is a negative risk factor. What that means is it's protective. It will prevent you from getting heart disease if you have a normal body mass index. In other words, you're not obese, you're not overweight, you're not like diabetic. I don't know, a lot of people with diabetes, but body mass index all by itself is a protective factor.
Interesting. This is number 9 is very interesting. Surprising it wasn't number 1, but smoking came in at number 9 on the list of 10.
Yes. Okay.
And why is that?
Okay, think about this. All of the things before that we talked about, there's a whole bunch of stress-induced ones, inflammatory-induced ones. What does smoking do that causes heart disease? Well, you're breathing in a lot of chemicals that damage the lining of the arteries. So that's what smoking does. But guess what else smoking does? It lowers stress. So you have people who, in fact, if you look at just cigar smokers, compare cigar smokers to non-cigar smokers, and take their risk factors and make all the risk factors otherwise the same, cigar smokers have less heart disease or less likely to die from a heart attack than non-smokers. Why is that? Well, the assumption is if you're lowering the stress, then you allow repair of the arteries. So yes, smoking damages the arteries, but lowering the stress allows better repair of the arteries, because we're all doing damage to our arteries, some more than others. And so all of those things that damage are risk factors. But it seems like the things that prevent repair are more important, because all of the ones above that are things like stressors that prevent repair.
All right, guys, number 10 on the list of top 10 greatest factors associated with dying from heart disease, according to this study, is gender.
Gender, okay. So yes, if you're male, you're definitely more likely to die from heart disease than if you're female. And there's reasons for that. It's not all known, of course. There's things involved like hormones. Because if you look at the study, just like the cholesterol study, the dying versus cholesterol, women are all over the place until they go through menopause. And once they go through menopause, then they're like the same as men. So women get like a head start up to age 50-ish, right? They're at significantly decreased risk, and then after that, their risk is essentially the same as men.
Interesting. This has been really good. One of the things that is not on the list that I think people may be shocked by is blood pressure. Blood pressure is significantly associated with this.
Isn't that interesting? Blood pressure did not make the top 10 on the computer list. Remember, this is a computer. This isn't a drug company, because everything else we get is a drug company advertisement, right? And in fact, the medical journals are essentially just drug company ads. Every article in there it is paid for by somebody, and usually it's a drug company, and they usually have a reason for printing that. And so this is totally independent. It's like this computer doesn't even care what the drug company thinks. It's just going to put boom, just associate. Okay, heart disease, what is associated? Well, this is high, and that's what the computer does. Blood pressure is not significantly associated with it. And that's really very interesting.
Yeah. Obesity didn't make it onto the list, which we kind of mentioned a little bit.
Well, that's just because the reverse, the having a normal BMI protected you from getting heart disease or dying from heart disease.
How about this? How about diabetes? That wasn't on the list of top 10.
Diabetes isn't on the list top 10 because diabetes, remember, does damage to your arteries, but it doesn't stop you from repairing the arteries necessarily. So it is a risk factor, but not as much as people might think.
Wow, this is so interesting. Okay, I'm going to hop over here, see if we have questions here from anyone. Oh, this is great. Well, actually, let's do this. So if we are looking to prevent heart disease, or maybe we have heart disease, kind of the whole point of this webinar is to teach, to educate, but then also talk about our Healthy Heart Solution Kit. And Dr. Saunders, could you just give us a quick overview of what this is and why someone may want it?
Okay, so who would want this? Well, the number one cause of death in the, at least in what they call advanced societies or whatever, I don't know if it's advanced really, is heart disease. Heart disease is still the number one cause of death. So it's significant, it's real, and it's a problem. And so why did we do this? It's because there is so much out there that is wrong information. There's so much, how do people even know how to prevent heart disease when they're telling you cholesterol is really important? And the computer says, no, cholesterol is not important. And every study that's ever been done says, no, cholesterol is not important. And yet there's still this idea out there that is persistent because of advertising, that cholesterol is important. So we needed a way to help people to understand what is the real risk factor, what are the real risk factors for heart disease, and what is a way to prevent heart disease. And if I already have it, what can I do about it? So the Healthy Heart Solution Kit is the answer to that. It's an answer, it's part of it. So it gets you started, and then the webinar is where we can do the specifics and more understanding and bring more information in, and people can ask questions. Well, what about this? What about that? And so that's where we can give more information. And part of the solution kit, a big part of it, is how to reduce stress. And you'll know why that's important just because as we went through these 10, how many of them were involved with stress? It's like, oh, that's a stressor, that's a stressor, that's a stressor, that's a stressor. In the top 10 causes of heart disease. So whereas most other places, we couldn't find any other heart program that dealt with it in that way. Almost everything is, oh, take this pill, oh, this supplement, you need more berberine. You need more of whatever. Oh, you got to lower your cholesterol. You got to lower your blood pressure. And those are all useless things. They're not going to help you. So that's why we made the Healthy Heart Solution Kit.
And can I jump in? We have a recent testimonial of someone who was taking berberine, turmeric, fibrogreens, and the Healthy Heart Support. And she went to the hospital to test for severe blockage. And the blockage was only mild.
Oh, good. What,
yeah.
You mean it got better?
It did. It got better.
Oh, wow.
Taking our supplements and yep.
Awesome.
Very cool. Very cool.
So
If you're
I'm not
interested,
saying don't take, yeah. I'm not saying don't take the supplements. I'm just saying that's only a part of it.
Yeah. I call them the helpers. They're the helpers.
Yeah, the helpers. The helpers.
And if you're interested in this, head to bartonwebinar.com and you will find this. You'll also find our supplements there. But if you use code webinar25, you will save 25%. Now you can get this hard copy, or you can also get the downloaded digital version, which you can have instantly, which is a great option because then you can dig in right away if you want to get started and start making changes today. Okay. Marion says, good news. My doctor said I don't have heart disease. How do I keep my heart healthy?
Oh, okay. It's everything we talked about. Eat good food, get good nutrition, exercise regularly, get decrease stress, decrease inflammation. All of those things are going to help you to have a normal heart function.
All right. I had a question come in here on Facebook, and it says, what about high lipoprotein test results? What type of doctor should I see if I have high numbers?
Okay, so lipoproteins are cholesterol, for example, is lipoprotein. And those are the ones that are not really important. But lipoprotein A is a significant problem for some people, and that's more of a genetic thing. So if it's high, then your question is, who should you see? That's not, I don't know, because most cardiologists are not aware of lipoprotein A, even though the studies have been around for 50 years. It's like, this is old information. And usually it takes about 30 years for the studies to come into the medical literature. But I have found cardiologists are mostly not aware of it. So I don't know, maybe you could call around and say, okay, are you familiar with lipoprotein A, LPA? But you can go online and find all kinds of sources of how to lower your LPA. And we're going to do a whole webinar on how to lower LPA.
Okay, I also had an email here from Marilyn. Marilyn says, where do you start making small and measurable changes to lower blood pressure and decrease or eliminate medication?
Okay, so where you start is why. Start with the why. Why do you have high blood pressure? So if you have high blood pressure because of stress, and it's a stress hormone problem, then the blood pressure is not your problem. It's the stress that's the problem, because those stress hormones, remember, that's what prevents you from repairing your arteries. Because if you have low stress, you're going to repair your arteries. Yeah, you'll do damage, but you'll repair them. So, the pressure is just an indicator that something's wrong. And so what you need to know is why. Why is your blood pressure high?
All right. Kathy says, if one is sarcopenic, will this condition make one prone to heart disease?
Potentially, yes. Sarcopenia means you have fewer muscles, cells. So that means your muscles are going to tend to be weak. You don't make muscle cells easily. Some people have tons of muscle cells. They're just born muscular. And other people just have a little bit of muscle cells and not a lot. And that could be just genetic differences. And sometimes it's an inborn error of metabolism, in which case the heart will be affected. So the thing about muscle cells, though, is you can build up muscle cells. And so gradually increasing exercise is a good way to build up your heart as well.
Interesting. Okay. We had a question here from Don. How do we know if we have heavy metal issues? Is there a test, or is it just in the blood test panel?
Oh, it's not in the blood test panel. You have to specifically look for it. And I've had people with significant blood lead levels elevated, mercury levels elevated, and you have to have you have to be suspicious of it at some level to order the test. I'm ordering the test because you have anemia. Anemia is low iron in the blood or low hemoglobin, and your cells are big. That means either you're deficient in folic acid or B12, or you have some toxicity, mercury, lead, or something like that. So there's usually a reason. For example, one man that I had, he had actually Alzheimer's disease, and he had heart disease, and he had arthritis, but he was a welder, and so I did a lead test, and his lead was off the charts. It was like 50 times the upper limit of normal. It was way out there. And so with chelation therapy, he actually got all better. His heart disease went away. He didn't have any chest pain. He didn't have any arthritis. and he didn't have Alzheimer's disease anymore. So, so the way you know is to test, and you have to specifically ask for it because you're suspicious of it for some reason. He was a welder, so he's like breathing in, metal dust and vaporized lead.
Wow. I've seen people doing like foot soaks to detox from metals. What is your solution for those?
Does that work?
Yeah.
I don't know. I wouldn't suspect that someone who had a high tissue lead level. The idea is to, if you pull it out of the feet where it's collecting, then the other lead in the body will then collect there because of the change, and then you can just keep doing that to detox. I don't know how good that is.
Sure.
I wouldn't suspect that would be a good way of getting your lead levels down to normal.
Okay. Our friend William is on, and he said, I heard yesterday on our diabetes webinar that we were looking into making an omega-3 supplement. This can help build a bulletproof cardiovascular system. My brother said he quit taking an omega-3 supplement because it made no difference. Research says that fish oil is a scam because it lacks the companion nutrients omega-7 and omega-9. With these together, it improves your heart health, pain-free joints, reduces cognitive decline by 40%, a much faster metabolism, and many more benefits. One last important thing to add is krill oil because it causes the body to absorb more of the omega-3, 7, and 9. Looking forward to this supplement. Any thoughts about that? We didn't mention that on this webinar, but that is something that we're looking at. Joe, our founder of Barton Publishing, was on our webinar yesterday and was looking at different omega supplements, and we were chatting about that. But what are your thoughts about the benefits of those oils for cardiovascular health?
Okay, so the thing about oils is balance. And we talked yesterday about just omega-6, omega-3, and that how the diet and the standard American diet has like 6 times to 30 times more omega-6 than omega-3, and it's really imbalanced. So when people looked at that, they said, oh, let's just add some fish oils so that we can bring that, help to balance those omega-6 and omega-3 levels. Bringing up the omega-9, which is really important, omega-7, they're all important. All of them are important. We don't make any of those unsaturated fatty acids. If you, like, when your body makes fat out of sugar, and we make sugar into fat. When we have too much sugar, we just make it into fat and then store it in the fat cells. And that process always makes saturated fat. And guess what? Cows do the same thing. So that's why the stuff from the cow is going to be a saturated fat. And then any of the omega unsaturated fats, which would be omega-3, omega-6, omega-9, omega-7, those are going to be whatever the cow is eating. So if the cow is eating grass, you're going to get more omega-3 than omega-6. If the cow's eating corn, it's going to be just the opposite. So they're all important, but balance is the key. It's not that you should be out of balance like a ton of omega-3 and no omega-6. You still need omega-6 because those are important for your immune system to function as well. You need all of them, and we can't make them, so we have to eat them. So if we're not getting enough, that's where the pill comes in. That's where the supplement comes in. Ideally, you would eat enough, but
and how would that
not.
Yeah, and how would that help the heart then?
Oh, because part of that is the inflammation. So the inflammatory process is when there is more omega-3 than omega-6. The lining of the artery, the endothelium, gets damaged more easily. Omega-3 helps to repair things better. So having that repair process is really important.
Good stuff. Let's see, one comment here from Doreen. Can you please write the full name of CPA that you mentioned? I'm not sure what that is. What did we mention that was CPA?
CPA.
Was it the lipoprotein instead, maybe?
Oh, lipoprotein A,
Like maybe
LPA,
LPA.
LPA, yeah.
Lipo.
Yeah, LPA. So it's lipoprotein, and then it has a parentheses and a little a. So it's lipoprotein little a, as opposed to LPA. There's a big A too, and it is LPA2. No, this is lipoprotein little a.
It would be interesting to do a webinar on omegas and the krill oil versus flaxseed oil, talk about the benefits of each.
Yeah. Yeah, because they are different. They are different and they're used differently in the body. And some, like you can make DHA into EPA, and DHA is really important for the brain, and EPA is not so important for the brain. And they're both omega-3 oils. And so, everything in your body is made out of whatever you're eating. And so if you get your red blood cells and you take them out and you look at all the fats in them, then you can just determine by looking at the fats what you've been eating for the last 3 months, right? That's what your fats are. That's what's going to be. That's what those membranes are going to be made out of. And if there's a lot of omega-6, then they're going to easily have inflammation, and that's where the heart disease comes in. And if you have omega-3, that suppresses inflammation. So that's why that's important.
Okay, I think that's it for today. This was so good. I feel like I learned a lot. So I hope you all did too. This was great. Dr. Saunders, go be with your patients. Thanks again for joining us.
Bye.
I'm going to see. I think I did get through all of these, right?
Yeah, I think you did.
Okay, awesome. Again, guys, if you're interested in the Healthy Heart Solution Kit, you can find that at bartonwebinar.com. And there will also be a link to our YouTube channel. There's a link to our diabetes webinar if you're interested in that. There's a whole bunch of good stuff on that site. But don't forget to use code webinar25 because that will save you 25%. And the downloadable version of this is $19.97. But if you want the hard copy, it's a little bit more. But you might as well use the discount code. That'll save you some good money. So, all right. Oh, Velo and Barbie were here. Yay. Awesome. Doreen says, excellent. Thank you. Okay, you guys come back next week. Tell a friend. We're so glad you're here. Thanks again, Cheryl.
Bye. See you
Bye-bye.
later.